So, welcome, Deni. I'm delighted that you've come on today to have a chat about your recovery story using a mind body approach. And I'm really excited for you to share your journey because I think it'll just be so helpful for other people.
Hi, Katrina. Thank you for asking me to do this. I'm really pleased to be here. I'm really proud of myself for being here as well. Looking back to maybe a year and a half ago. But also, I think for me, what's really important is to share my story because I think that can give people hope. At least that's the way I watched and I listened to a lot of stories. And I think when you're in this really deep hole is really nice to hear that other people overcame similar issues, and it does give hope.
Wonderful. Yes, I remember actually you saying how you used to when if you were going through a bad patch, you used to go back and watch other people's recovery stories, didn't you? So
Yeah,
it's
yeah, yeah.
fantastic. It's fantastic that you're doing your own one now today.
Yeah.
So yeah, so would you just like to tell us a little bit about your backstory in terms of what symptoms you were trying to recover from and how they were affecting your life?
Yeah, I mean, for me, it was primarily lower back issues. Looking back, there were probably a few other symptoms with my knee, and a lot of this, what people call the symptoms moving along the body. And given the way my personality is, I was really overthinking things, really focusing on it, wanting to get rid of the pain, and actually that made things worse. And it got to a point, this probably began maybe in 2019, so that's about 5 years ago. And it was on and off, and it ended up ruling my life. It was all about my back. It was not being able to drive. I stopped exercising, picking up my toddler. I couldn't sit down. Like, I would look at the chairs and think, oh my God, I would just traveling, lots of other things. So it became really a real focus for me. So yeah, it was primarily around back and twinges and all these things.
Yes, yeah.
Yeah.
And yes, yeah, because you had some investigations as well, didn't you? And
Yeah,
yeah,
yeah. And actually, that was probably about 10 years ago. I had the first kind of official episode around back. I used to run, so I used to run half marathons. And
Mm.
at the time, I was training to do a half marathon, and I pulled my back, but it was quite the pull. So I did have an MRI. I did go and see a consultant. I had physiotherapy, but actually back then, I didn't really focus on it the way
Mm.
I did years later.
Yeah.
So probably what that meant is that I recovered quicker.
Mm.
I was just more accepting of it.
Yes.
Obviously, something remained in my brain around, when people talk about your disc and issues with your spine. But I pretty much moved on from it. But yeah, a few years later, I had several MRIs, X-rays. I saw every single health professional you can think of. I even reached out to work with a shaman. I mean, I was desperate
Yes.
to,
Yeah.
to find something to solve it.
Yeah.
But yeah,
Yeah. Interesting. And
yeah,
and so I think by the time I'd met you, you'd already found the mind body work.
yeah.
How did you come to find the
I
mind
think I had
body work?
listened to a podcast a few years ago with Howard Shubiner, and the concept made sense, but I think there was a gap between the concept about the programming and our childhood and trauma and how that impacts our body to where I was at. Um, and I think I did some EFT training, which is around tapping around the meridian points. So
Yeah.
it's a similar concept. And then somebody else mentioned him again. And at that time, I was pregnant with my second child. And a few weeks after he was born, I started to have a lot of anxiety, which was perhaps, linked to the postnatal depression I had. But my mind went always towards my back. And that's actually when the worst probably flare up began, and I had sciatica and all these things. So yeah, after that, I had physiotherapy, psychotherapy. I saw an osteopath. I went to work with a homeopath as well. And somewhere someone mentioned the name of the book, Unlearn Your Pain. Um, so when we were away, I started reading it and doing the work. There's a lot of prompts around journaling and how to journal,
Mm,
really digging deep into the emotions. And I began to to see a change that I had with my body and my emotions, and how all of those were really linked to each other. So yeah, that was probably around September time, and I think we met in November. So
yes.
again, because of the way I am, it was like read the books, do the work. But I think it was good to actually work with yourself to kind of help me provide that guidance, because often is really, for some people it really works to read the material and that's it, and for others like myself, I just needed more guidance. It was a lot of overthinking. My brain was constantly triggering me to doubt myself.
Yeah.
So I needed a lot of reassurance then. So for me, that's why it was really helpful.
Yes. Yeah. And was there any, I mean, that's amazing that you were able to read that book and then immediately take on board, the concepts in there and start working with them. But was there, I mean, was there anything in this journey, using the mind body approach, any strategies or moments where you really felt that they were a key part of your recovery? Did you have any favorite bits or bits that really helped you?
Yeah. So one of them was journaling, because I think I always journal in a way that I thought somebody would read my journal. So my mother tongue is Spanish. So actually, I would actually write in Spanish thinking nobody else is going to read this. So the journaling piece was really helpful, because it's more around, you have to write anything that comes to your mind, to the point that you might not even be able to read it back because of how fast you're writing. And that is the thing around writing without any filters.
Mm,
And I started to notice that made a difference, or maybe that brought up other things, other emotions, or other memories
mm,
that I hadn't really considered.
mm,
So that was one element, the journaling, and changing how I journaled.
mm,
The other one that was really helpful for me was somatic tracking,
mhm,
um, because I've always been very logical, thinking about how things work, but that really helped me to bridge that gap between what my mind was telling me and what my body was feeling, and just slowing things down.
mm,
That was, I saw the benefits from it quite quickly.
mm.
Yeah, which was really helpful, was really reassuring for me.
Yeah, yeah. Amazing, amazing. And were there any bits that you didn't really get on with, or with the
Um, no, I think, I mean, the journaling has changed. I don't journal every day. Sometimes I feel I need to, and sometimes I have this block of not being able to write something. But I think maybe I go back to the the programming where for me was about, you need to keep doing something else. You're not
Mm,
going to see the benefits.
yeah,
Um, so it's not that I don't like it. It's just I don't do it as often.
mm,
Um, but no, I wouldn't say there wasn't anything else that I thought was not um, helpful.
mm. And
Yeah.
the other thing I remember is that you having fun was a key thing, a key part of your recovery, as wasn't it?
Yeah,
Going
and
back,
still is.
yeah,
Yeah, and still is. Sometimes when I have a flare up, or maybe not a flare up, but just like, sensation in my body, I do now think about, am I having fun?
mm,
Because often that is what I'm not doing. I'm too focused on my kids or work, or just worrying about other things,
yes,
and I'm leaving the fun or the joy aside. Like, my focus for this year, for instance, is joy. Like, I want to do things that bring me joy,
yes,
and that makes things just easier and just fun.
yeah, yeah. I mean, you're quite creative, aren't you? And I've heard this from other uh, people that, sometimes a lot of people take up an art class or a pottery class, or and they just say that period of time that they take out in the week to go and just have something that's a bit fun for themselves, it just they lose track of time, the mind slows down. It can be really quite important, can't it?
Yeah, yeah, yeah. No,
It's
it really is.
when we don't feel when we're having fun, we feel less fear, and I'm sure there's loads of other things that help as part of that. But
Yeah, yeah.
so yeah, and how does life look for you now then in terms of what you're able to do? Because you quickly got back to exercising and things, didn't you?
Yeah, yeah. So I'm doing a lot of resistance training, so using weights, which again I never thought I could do again, where I was a year and a half ago. So yeah, a lot of exercising, and it is something I enjoy. I'm getting stronger. I'm able to play with my kids. I can pick them up. Um, it's funny. I've always had standing desks. Whenever I started a new job, I would say I have back problems. It's me. I have back problems. I need a standing desk, or I need some modifications. Whereas now I could sit and I don't think about it.
Mm, mm,
Um, yeah, and I think the most important thing for me has been not thinking back to the diagnosis I was given, to having to see a physio or an osteopath. If I go and see my osteopath, it's because I want to feel relaxed, because I do enjoy the treatment. Um, yeah, so for me, that's been a game changer. Just not focusing on what might be wrong with my body. That's been the biggest win for me, and
mate.
why I enjoy the most. Yeah.
Yeah, amazing. And I really like that idea of, yeah, going to see, going for enjoying a treatment from the basis that it really helps to just calm the nervous system down and yeah, let your body relax. I think that's a really good way to approach it.
Yeah,
Because they, sorry.
no, I mean, I was going to say that really took a lot of time and effort to let go of that need to be
Mm,
reassured
yes.
by
Yeah.
someone.
Because they can still have benefit. I still like to go for an osteopathic treatment just to sort of just to drop into a lovely space and just be helped. Just to have that. There's nothing wrong with a good massage because
Yeah,
it can feel
yeah,
lovely. It
yeah,
can
yeah,
be a nice
yeah.
treat. So if you could speak to someone in a similar situation to you before you started, what would you want to share? What if somebody is kind of listening to this and thinking, oh, phew, I don't know, I don't feel like I'm getting anywhere, or I'm not even sure about this concept or this journey. What would you? Is there anything you would share in addition to what you've said?
I think to be open-minded, to try it out and to give it time. And that might sound quite challenging. It was for me, just having to wait, not being given give it 6 weeks and you'll be back on track.
Mm,
But yeah, you don't lose anything. And if you think about it, our body and our mind are super connected. We gotta listen to both. So I think being open-minded, listening to other stories is really helpful, talking to other people. There are Facebook groups led by Serpa, and there's a lot of material online. So I think just that is really helpful. A lot of people can identify themselves with the symptoms they may be experiencing, um, and give them hope that this does work.
absolutely, absolutely. And the additional benefit of working with a practitioner, you mentioned it a little bit before, but for
Yeah,
somebody who's maybe read the books and is trying things out, what was it about the guidance that was, working with a practitioner that's helpful, do you think?
for me it was really helpful because it didn't feel like therapy. It really helped me by having that connection. I think we did quite a few exercises around somatic tracking. It was really helpful for me to connect with those emotions, and I don't think I would have been able to do that by myself. Also, whenever I had a blip and I started to overthink things, and the tools I had were not really giving me what I needed to kind of get out of it, that's when it was really helpful. Just having someone else to give you other ideas, other things to try. that perhaps, by yourself you don't.
Mm.
So I think that's really helpful. And I think it's just that reminder, that this is a journey, it takes time.
Yeah.
And yeah, sometimes we just need that.
Mm. Yeah. And you worked really hard. I mean, you were kind of one of those students that was just amazing to have, or to work with, because even within your busy life, you had two young children and lots going on. You just embrace when people do the work, they get the results. And I was in full admiration for, the effort that you put in. But as we all know, it's also putting in the work and the effort, but with kind of not worrying about not the intention, not so much on the outcome. And I
Yeah,
think there's something you've said in your write-up about learning not to focus so much on resisting the pain. I thought that
yeah.
was really interesting. Yeah.
Yeah, because it is hard. It is really hard to not panic. I used to feel something and I would panic. It was panic. It would derail my whole day. That's all I would think about. I just would want to be by myself, overthinking. So that has been amazing, absolutely amazing.
Yeah.
Yeah, yeah. And it's interesting. We've been chatting about this. So sometimes saying when other people are going through the same journey, it would be great for them to learn about this, about the program and about the mind body connection and what can do for them, for anyone really.
Mm.
Yeah.
Yeah. Yeah. Did you ever talk to other people about it? And
Yeah, I used to work with somebody that had chronic migraines. But again, I think sometimes people need to be ready.
yes.
I really try. I really wanted to help, and that was part of my personality. Go fix it. But
Yes. Yeah.
actually, I shared my experience. I shared how it was working for me because we always used to talk about my back and this person about their migraines. Um, but actually, I think one needs to be ready. I think being open-minded is really, really important
Mm.
to, nothing changes if nothing changes.
No.
So
Yeah.
that's really important. Yeah.
Yeah, that's a lovely phrase. And this is sometimes the best way of guiding people by just recording something like this and putting it out there. And then when people are ready and they listen to these recovery stories, it can, sometimes that can be the turning point. So is there anything else you'd like to share? Because I just wanted to, congratulate you on your on your recovery story. And we talked earlier, didn't we, about the fact that it is an ongoing process, because you reach that point of recovery, but we still carry on doing the work because sometimes little symptoms arise and we
Yeah.
have to do it. But yeah, is there anything else that you'd like to say before we go?
No, I think just for whoever is listening to this, just to have hope. I don't think I've mentioned it, so I know I mentioned about the lower back, but I think when we met, I got to the point people, surgeons wanted to operate, because how they thought the images showed my back. Um, so just in that case, um, a lot of medical professionals might tell you you've got all of these things going on. I think just being open to trying something else
Mm,
before going through something quite significant like a back surgery,
yeah.
I think it's
Yeah.
really worth trying. I don't have any issues, touch wood. Yeah, yeah,
Yeah, absolutely. Absolutely. Because I mean, don't get me wrong, surgery can often be
exactly.
an
Yeah,
option, but the rates for complete recovery from back surgeries, the actual statistics are not always that fabulous anyway. And there is a risk involved. And that's really what brought Dr. Sarno and some of the other orthopedic back consultants from the States, like Howard Schubiner, to start doing this work because they realized that there was something else going on. So yeah, I didn't realize that you'd faced possible surgical options. So
yeah,
that's
yeah. When they looked
great.
at my MRI, they said, "Yeah, you need surgery."
Oh
Had
really?
steroid
Yeah.
injections, and it was quite lucky. My osteopath at the time, she had had the same problem,
Mm,
and she said, "Just wait, just
Yeah.
don't do it. I treat a lot of patients. Look at myself. I'm running. Yes,
Yeah.
sometimes I have flare-ups. That also gave me a lot of hope.
Yeah.
So yeah.
Oh, good. I'm glad. I'm glad to hear that from your osteopath. That's yeah, that's good advice and wonderful. Well, thank you so much for coming on today, Deni. As I
No,
say,
thank you.
congratulations, and it's a testament to all the work that you put in. But yeah, it's really great to hear your story, and I just yeah, I hope it's of use to anybody else out there who's in a similar situation that they can feel inspired to go forward. So thank you very much,
No,
and
thank you, Catherine.
have a
Thank you.
great day.
You too.
Take care.
Bye bye.